will demonstrate the arrangement of the mandibular anterior teeth in balanced occlusion and the establishment of the incisal guidance angle. But before we start sitting our teeth, we must emphasize and clarify some important points. As we have a normal jaw relationship between the maxilla and the mandible, described as class 1 jaw relationship, the mandibular anterior teeth are set lingually to the maxillary anterior teeth, creating a horizontal overlap. This horizontal overlap is called the overjet. Now, the incisal edges of the lower or mandibular anterior teeth also will be set slightly above the horizontal plane, the occlusal plane indicated by this line, creating a vertical overlap with the incisal edges of the maxillary anterior teeth, and this vertical overlap is called overbite. Now, when the mandible in its centric relation position or in its maximum intercuspation position, as the two positions are coincident in complete denture occlusion, and this is a characteristic feature of complete denture occlusion, the centric relation and centric occlusion are coincident, the mandibular anterior teeth and maxillary anterior teeth, they never come in contact. They never come in contact. We have vertical overlap and horizontal overlap. Now, if we draw a line from the incisal edges of the maxillary anterior teeth to the incisal edges of the mandibular anterior teeth, this imaginary line will create an angle with the horizontal occlusal plane indicated by this horizontal line. This angle is called the incisal guidance angle. On the articulator, we have an equivalent component called the incisal guidance staple. It has a similar function to the incisal guidance angle, and the inclination of the incisal guidance staple and the incisal guidance angle should be the same while sitting the teeth. Now, as we are using an average value articulator with fixed value for the inclination of the incisal guidance table of nearly 15 degrees, our sitting and the creation of the incisal guidance angle must be the same as the inclination of the incisal guidance table. This will be demonstrated while we are sitting the teeth, and this is an important factor in achieving a balanced occlusion. Now we will start sitting the lower anterior teeth. Now, as we mentioned earlier, each tooth must be observed from three views: the labial view or buccal view to see the long axis of the tooth, and from the proximal view to see the inclination of the tooth buccolingually, and from the occlusal or incisal view to see the occlusal situation of the tooth. I'm going to summarize quickly the three views for these lower anteriors, then we move immediately to sit the teeth. Now, here we can observe the labial view of the lower anteriors. These, the two centrals, you can see that the long axis will be perpendicular to the occlusal plane. The lateral incisors, the long axis will move distally at the neck area slightly, while the canines, the long axis will move more distally at the cervical area. Now, if we monitor the proximal view, for here we can see the central incisors, the neck will be slightly depressed, while in the lateral incisor the long axis will be, or the labial surface will be vertical. Now in the canine, the neck area will be prominent and the incisal third will move lingually. Now if we look to the occlusal view, we can see that the shape of the arch, each tooth will re-establish the labial contour of the wax rims, and the shape of the arch will be similar to the shape of the maxillary arch. So they are the same curvature, as if they are parts of two circles with a different diameter. Now we can observe here, when we look at the labial view, that the incisal edges of the mandibular anterior teeth will establish a horizontal plane slightly higher than the occlusal plane, and this distance here from the horizontal plane of the incisal edges of the sit lower mandibular teeth and the occlusal plane will provide us with the amount of overbite with the maxillary anterior teeth. Okay, but now we are going to start sitting the teeth tooth by tooth and see how are we going to achieve the goals for sitting of the lower anteriors. Now we have to place the mandibular cast in position and make sure that the incisal pin is at the 0 line with the upper member and completely touching the incisal guidance staple here, and we have completed the sitting of the maxillary anterior teeth and the maxillary posterior teeth as well, and we are going to proceed now for sitting of the lower anterior teeth and make sure that we put the display piece in this situation so we will not be confused between right and left. This is the left side, this is the right side, and we'll start sitting the lower central incisors. Now we are going to remove a piece of wax from the lower wax rim at the midline, so it will accommodate the central mandibular incisor. At the midline, as you can notice here, we'll remove a piece of wax from the buccal to the lingual, and we soften the wax in the area so we can insert the tooth. Here we'll remove the lower central incisor, the left lower central incisor, and place it in position so it is little bit higher than the occlusal plane, as you can see, labially inclined, long axis is vertical, and here is the amount of overbite created by the sitting. Now we close the articulator and see that we check the midline to be coincident with the upper midline. Now we secure the tooth in its position. We use a hot instrument by melting the wax around it, and you can notice that the neck is slightly depressed. We also secure the tooth from inside. Now as you remember at the beginning of this video, I mentioned that the incisal guidance angle we create in our sitting must be the same incisal guidance angle set at the articulator at an average value of about 15 degrees. Now, if these two angles, the incisal guidance angle we created by our sitting and the incisal guidance angle set at the articulator, at the incisal guidance table, are the same, that means when we move the teeth in conclusive movement and put the teeth, anterior teeth, edge to edge, the pin, incisal pin here, must not separate from the occlusal or incisal guidance table. Now we release the centric stops, those two thumb screws, and move the maxillary member, the upper member, in backwards as if we are moving in the patient mouth the mandible in conclusive movement, and we can see here that we can put the centrals in edge to edge position, but the incisor pin raised, and we have here movement, heavy contact between the two centrals. What does that mean? That means the incisal guidance angle created here is steeper than this one. All what we need is to reduce the height of the lower central incisor and decrease the amount of overbite. Now, at the same time, can increase the amount of overjet. Both procedures, decreasing the overbite or increasing the overjet, will reduce the amount of incisal guidance table. Now I reduced the amount of overbite, and I will check again. As we mentioned earlier, we move the maxillary jaw backwards, and you can see that I can achieve edge to edge movement while the pin is still touching the table. Now the touch between the incisal edges should be brush touch, very gentle touch, light touch, so the teeth will not move and the incisal pin will provide a mechanical protection for the teeth, as you can notice here. So I will fix it in its position. And I will proceed to set the lower right central incisor in the same position to have the same incisal guidance angle, and we have to establish a contact point between the two centrals. We melt the wax in between. The long axis of the teeth should be perpendicular, and if we look incisally, we have to fix the tooth also from the lingual side. By melting wax around it. Now, using a cold instrument, I can adjust the teeth. Now the curvature must be established from this stage, the curvature of the arch so I will not get a flat sitting. Now I will examine the incisal guidance angle created by my sitting, whether it is the same incisal guidance angle at the occlusal or incisal table, incisal guidance table. Now we need to move this little bit downward. Now you can see that I can achieve edge-to-edge contact without separation of the pin and without movement of the teeth. Now the teeth are in a soft wax, warm wax. Now if there is no mechanical protection for these teeth provided by the movement of the incisal pin on the incisal guidance table, the teeth will move. Now all what I have is brush contact. Now it's important to mention that in centric relation, which will coincide with the centric occlusion, the lower anteriors never touch the upper posteriors, and we can check that by putting an articulating paper. You can see here we have an articulating paper. If you put an articulating paper here, we can notice that there is no touch between the two teeth. Okay. Now we proceed for the sitting of the lateral incisors. We cut a piece of wax and melt the wax. We cut a piece of wax and melt the wax inside, and we continue the curvature of the arch. Once we establish the height of the teeth, we can follow the same height, and that can give us the same incisal guidance angle. Here, as we mentioned, the long axis of the lateral will be slightly inclined to the distal at the neck area, while the profile or proximal view, it is vertical. Now we fix this tooth in the wax by melting the wax around it. Now we can see that the curvature started to move, and this will reproduce the contour of the wax rim, the original contour of the wax rim. Now we can see that we don't have enough overjet here. We have touched, so we move the tooth lingually to increase the amount of overjet or the horizontal overlap. Now you can notice that here we have overjet, and the overjet between the teeth must be equilateral, so equidistance, so all the amount of the overjet must be the same, an equidistance overjet. Now you can check the incisal guidance angle created at the lateral. You can see I can achieve edge to edge without the separation of the pin from the incisal guidance table. Now I proceed to set the right lateral. You can set the canine no problem with the sequence. We soften the wax in the area. Take the right, lower right lateral, and we place it in the wax as the wax is soft. Long axis will be slightly inclined to the distal at the neck area, while buccolingually it's gonna be vertical, and we establish the incisally we establish the contour of the original contour of the wax rim. We melt the wax now from lingual aspect, so teeth will be fixed in the wax. Each tooth must be evaluated for the amount of overjet. Now you have a little bit increased overjet here. I can move the tooth slightly to the buccal, so I have equidistance overjet. I evaluate the incisal guidance angle created for the lateral. I can raise it a little bit. We have enough space here. Now you can see that I can achieve edge-to-edge contact, brushing contact without separation of the pin and without movement of the teeth, as they are mechanically protected by the movement of the incisal pin upon the incisal guidance table. Now I proceed for the setting of the canine. As you remember, we said that the canine will be lingually inclined, buccolingually, and from the labial view, the neck will move distally little bit more than the lateral. Canine and put it in the proper angulation from the first beginning. The tip of the canine will conform to the established occlusal plane or established horizontal plane by the incisal edges of the centrals and laterals. I will fix the tooth in its position. You can notice that I put the long axis a little bit more than the lateral. The neck is moved distally a little bit more than the lateral. I soften the wax from inside, fix it from inside. And we can see that it is touching, so we need to reduce the amount of overbite. I place the canine inside the wax and increase the angulation. Now you can notice that I achieve equidistance overjet with the canine. I check the movement of the canine in conclusive movement, a little bit causing slight separation, so I need to increase the overjet or decrease the overbite. I will explain in a minute the two maneuvers. Now you see, now I can achieve edge to edge contact without separation. Now with the canines I need to achieve tip-to-tip contact between the maxillary canine and the mandibular canine in lateral excursion without separation. And you can notice here that I can do this lateral excursion and the tips of the canines, the maxillar and mandibular, are very close, almost touching without separation. Now I'll proceed to put the lower right canine in the same way. And you can see it is an easy procedure once we understand what we are doing and what we are looking for. What do we need to achieve? The last tooth, the lower anteriors, the lower right canine, I put it so the neck is prominent and the long axis goes more distally than the lateral. After I finish the sitting of the 6 anteriors, and while the wax is still soft, I can do some final adjustments. Okay. Now you can notice here that I have an equidistance overjet. Long axis is more distally. The lateral, I need to push the neck of the lateral so the tooth will be in vertical position buccolingually. Now if I move here, I notice that the canine is raising, so I need to decrease the amount of overbite by pressing it and reduce the amount of overbite. Now the canine here is no longer interfering with the conclusive movement, and I can see that I still have a chance to raise it a little bit so I can achieve tip-to-tip touch with the maxillary canine in the lateral excursion. I can tip-to-tip the canine without separation of the pin. The incisal pin must not be separated from the incisal diamond staple. Now I can, as I mentioned earlier, adjust the alignment of the teeth. Now we continue cleaning the wax surface in preparation for the waxing up or festooning after we finish the sitting of the teeth. Now we check our sitting for the lower anteriors, and you can notice here what I already mentioned and emphasized on: an equidistance overjet. The amount of overjet must be all around the arch the same amount. Now we check the protrusive movements. As we said, we open the centric locks here and we move the mandible backwards as if we are moving the mandible forward. Now you can see that we can achieve edge to edge touch the anteriors without the separation of the incisal pin. And in lateral movements, lateral excursions, you can see you can achieve tip to tip with the canine and tip to tip with the canine without the separation of the pin. You can see that at the same time the teeth do not interfere with each other, so they have only brush contact. No teeth will be displaced from its place. This is an important point, as you can see here. Now, as I mentioned earlier, we can control the amount of overjet to overbite, and this will help us to reduce or decrease the incisor guidance angle. If you notice here in this diagram, now here we have the maxillary anterior teeth set to the occlusal plane. This is the occlusal plane, and this is the maxillary anterior central incisor. This is the mandibular central incisor. Now, if you notice here, if we put the lower central incisor in this position, we have 2 millimeters of overjet and 1 millimeter of overbite. Now, if we want to decrease the incisor guidance angle, we have two options: whether to increase the overjet like this way we decreased the incisor guidance angle, so we can increase the overjet, or decrease the overbite. Okay, if we put it in the original position like this, we can reduce the incisor guidance angle by reducing the overbite or by increasing the overjet. We can control the incisor guidance angle so it will become matching with the inclination of the incisor guidance table, which is about 15 degrees, so we can achieve balanced articulation for the anterior teeth, where we can achieve edge-to-edge contact and tip-to-tip canine without the separation of the pin. And this means that the incisor guidance angle of our sitting is the same as the inclination of the incisor guidance table. Now, the coming video will be the sitting of posterior lower or the mandibular posterior teeth in balanced occlusion. See you and have a good time.